Welcome to episode 40 of the Progression Health Podcast. I'm here with Dr. Jacob Templar. Jacob, do you want to introduce yourself?
Yeah. For anybody that doesn't actually doesn't follow me, because a lot of people don't follow me. Like you said, Jacob Templar. I have my license in physical therapy in the state of New York. I practice in Rochester, New York, and I live in the surrounding area. I got my bachelor's degree at Utica College, and I also got my doctorate there. I graduated in 2016. Since that time, I've done a lot of different things. I have a couple research projects that I'm working on. I've done a lot of work with the American Physical Therapy Association, where I hold like a position as like local governance of that. I'm on the executive board. I've done national level stuff. I've given talks internationally and nationally about different topics. I worked with the strength guys for 3 years as an injury consultant for high level powerlifting. And then now I'm working full time in the clinic and doing some coaching with a different group now.
Yeah, so you have like extensive background and level of experience. And what interests me is the level of scientific knowledge you have. And also you have the experience of lifting as well. You've got like the nice mix of both. Yeah. When someone has only one, so when someone has like the credentials without the actual in the trenches experience, or when they have only the in the trenches experience and without the credentials, it's kind of like wonder what they're missing, but you have both, which is great.
And I get to see some of that stuff even with like some of the national stuff I did with APTA. Like you can see where there's like a difference between what some people think that are maybe just in academia now and aren't always practicing versus people that are kind of either mixed or practicing but not in academia.
Yeah. What would be some of the kind of things you'd notice? Like, let's just say, someone's listening, right? And they're like, this person I follow online, puts out really good information. Joel Seedman, for example, right? Puts out good information. Looks really cool, but like, how do I know if it's legit? Like they have a PhD, but I don't know if they lift, or like they're an IFBB pro bodybuilder or powerlifter or whatever. And like, they don't have a PhD. How do you spot someone who's got the quality info?
A lot of it is just the way that they'll talk about things. Like you notice a degree of certainty. Whereas, that's where I try and be balanced for the most part, and say like, this is what, and when I write up like things for my posts, Microsoft Word really hates it, the way that I write things, because it always like autocorrects me and says this is like a passive tone, but it's like, I'm writing that way because it is how you would speak scientifically. Like you're like, well, I don't have certainty about this. This is what we think. This is what we can infer. This is, things like that, versus being like, oh yeah, it's always this, you have to do this and you can't do this. And typically the more and more somebody gets like that, tends to be much more involved with like academics, or is trying to be more, honest, is the best way to put that.
Absolutely. Yeah, that's funny you say that Microsoft Word gives you that passive feedback, because I use Grammarly, and Grammarly tells me the exact same thing. It's like, your tone is too passive. And I'm like, yeah, but I can't say for certain if like 10 reps is better than like 5 reps, or the deadlift is better than the squat or whatever, because like they're just not, it's like, I'm being honest here. Yeah. Just kind of like you said. So yeah, if someone is especially certain, then they're probably just kind of like extending the truth a little bit.
Yeah. Because the only things you can be certain of are things that are like tried and true scientific principles.
Absolutely. So like regular exercise is good. None is bad, and too much is bad. And like, progressive overload, and, there's only a few like fundamental principles that you can actually like, kind of bet on. Whereas, if something seems too good to be true, it usually is. So, but it is tricky. I think people who are like kind of charlatans or are extending the truth have got very good at doing that, which is tricky.
Yeah. And it's harder when you, I don't know, because like I've noticed this too. There's like a few people that I've had, debate with or discourse, where they'll cite a reference or something. You'll read the reference and you're like, I don't understand how you got what you came away with from that, because I would have interpreted it differently, versus like, the references I try to use would be ones that either I'm directly talking about it to like say why I disagree with it, or you should be able to read that paper and go, okay, I see where you made those connections and where this information came from.
Absolutely. Yeah. You can see the line of thought. Would you ever post a bit of research or science and say that like, this is an example of something I disagree with, and this is where the science is wrong, or the editors or the researchers made a mistake? Would you ever do something like that?
Yeah. I've done that more recently with like especially passive modalities. And I think
the Progression Health podcast has teamed up with TRX. So TRX is a bodyweight training piece of equipment that you can hook up anywhere, anytime. And I highly recommend it. I use it in every session with my clients. I use it to warm up and also for stretching. But if you are traveling, which is where I recommend everyone use it, it's hard to get to a gym. It's hard to find the time. But you could literally work out from your hotel room with the TRX and the door attachment that it has, where it doesn't damage the door, but it gives you an effective workout. I also like to add in other things like glute bands and resistance bands. But once you have the TRX, then you can figure all that out. So get yourself 50% off on the TRX home workout equipment with the code Progression Health TRX and boost your workout effectiveness and consistency. Progression Health podcast is brought to you by BetterHelp. BetterHelp is an online therapy service which will help you to more effectively manage your mental health. Mental health is very important, and it's something that all of us are realizing now, especially after the pandemic. During the pandemic, for me especially, it was very challenging, and I reached out to BetterHelp. I tried out a few of their licensed therapists, settled on one for the majority of the pandemic, and I found the help that I received invaluable. And the great thing also is that you can speak to your therapist outside of sessions. If it's not working out, you can switch. Very affordable. It's really easy to use also. And if someone hasn't tried therapy before, but you're kind of, you're curious, I would highly recommend BetterHelp. So what we've done is we've got a sign up link I'll attach in the show notes, and basically you can get a discount to get started and start improving your mental health today. So BetterHelp for better mental health.
Talked about that with like craniosacral therapy.
Could you give some examples of passive modalities just for people who don't know?
Yeah. Yep. So that'd be like kinesio taping or KT tape, therapeutic ultrasound, which wouldn't be like imaging to like look at your organs or a baby or something like that. It's meant to generate some kind of heat, hot or cold packs, TENS, so the electrical currents that people think of when they go to like a chiropractor or a physical therapist or something like that. This other one, and foam rolling was one that I discussed too.
Don't take foam rolling from me yet. I value it 2 marks every time.
Well, that's what the science shows, is that if you believe that it works, it will work. So if it's worth your time investment, the using it, I guess.
Yeah. The placebo effect is strong. But it's funny you mentioned the hot pack. So I have a run coming up on Saturday. I'm going to do a half marathon, and I was like, I'm feeling a little bit of muscle soreness. What can I do? Trying to sort of optimize recovery, but I know that it's like a bit of a fallacy, or, you can't really optimize it other than just sleep well and program well. But I have, it's funny, I'm looking at my calendar and I'm like, hot tub Friday night, the night before the run, because I'm going to hope that the heat will improve recovery. Do you know anything about, sauna, hot tub, hot water immersion, I guess it would be, for recovery?
That's the thing. It's like, how much does it help? Like, it's not that it doesn't seem to have like an effect, especially for like muscle soreness, where there's been some papers, I think, on like muscle growth and things like that. They've shown it has an effect. It's just like the degree of the effect. It might not be worth somebody to invest 30 minutes in doing that if it's going to take away from like them actually, sleeping more or eating enough or drinking enough fluid that's non-alcohol, like stuff like that.
Yeah. So it's kind of a gray area, right? It's like there's there's not even a protocol for hot water immersion, is there?
I'm not that I'm aware of. I've read some stuff on like delayed onset muscle soreness. So like the soreness you'd get after exercise. But yeah, there's not really I think the stuff for like muscle growth is like, it has to be within, it's almost like there is an anabolic window of that. It has to be within a certain time period after exercise for it to actually seemingly to have an effect.
Yeah, I actually heard the opposite then I think it's cold water immersion. I think Brad Schoenfeld said that cold water blunts muscle protein synthesis. So basically, I'm not sure does the same apply for the heat, but yeah, there's just no protocol for some of these like external modalities or passive modalities. So like even foam rolling, for example, like if you had a client, would you recommend foam rolling? Is there a protocol for foam rolling?
I mean, I'm sure there's some in research that I could find, but I typically would, most of the time focus on other areas first, unless that's like going to be the easiest thing to change, or it just has not like a lot of investment in the time or something like that.
Yeah, which is funny you say that, because it's like I'm in the gym every day. I'm like, I swear I see somebody every day doing foam rolling. And I'm like, do you not realize like you have limited time and like your time could be allocated more effectively to like so many other things? Like, what are your thoughts on sort of just like just the effectiveness, allocation of time and these passive modalities?
Yeah, I mean, that's the thing is like you're usually at least having to invest like 10 to 30 minutes at a time with them. And it's like, well, that's potentially 30 minutes, 10 to 30 minutes, you could have been doing something else that may have more of an effect either on recovery or like the goals that you're trying to get towards. I mean, because 10 minutes of exercise just by itself, if you don't exercise at all, is a significant amount of time.
Yeah, absolutely. I saw another podcaster, Simon Hill. He's got a great podcast, and he was talking about, doing like 3 bouts of like 10 or 20 minutes of like high intensity exercise a week. And that is all you need for cardiovascular, like heart benefits.
Yeah.
And people would spend that time foam rolling. And foam rolling, we don't even know the benefits.
Yeah. And like I would have, I've had patients do this, like just be like, yeah, start with like a 10-minute walk. Like if you're not doing anything, that's going to have a substantial effect on like your blood pressure, probably even on sleep regulation, like can affect your hunger, can affect, your heart and lung health just in general, besides your blood pressure.
Yeah. Like walking. Yeah. So it actually be exercise, but also I can find it sort of like therapeutic and relaxing as well. So there's there's a lot more research on walking, I would say as well, because it's been around.
Yeah.
So then just thinking of, would you count, thinking of passive modalities, would you count stretching as a passive modality? And then what's your opinion on stretching? When's it most effective? When is it ineffective? What are your thoughts around that?
I mean, it is an active thing, but it's depending on what your goal is, right? If you want to or need to regain range of motion, then that may be sometimes our best like approach to like have somebody do that, but it's building a tolerance into a position. But like at the same time, depending on if you're a lifter and you can't get in a position and it's, if you're a novice to it, well, if you just keep doing that activity, eventually you'll be able to get into that position anyways, because it's just more exposure and building tolerance to those different positions. Versus like somebody's much more experienced and having trouble with that, I might then give them, okay, let's do this kind of stretching, quote unquote, so that it makes it easier to achieve what we're looking for right away.
Got it. Yeah. So I'll give you like an example I come across very commonly on the gym floor. So I'll have a new client, they're like detrained, so they haven't trained in years, or they're new to like barbell training, which is typically where we'll go if we have no kind of contraindications or reason not to. So then basically in my head, I'm kind of, there's 2 sides to it. It's like this person is trying to hit depth in the squat, for example. And it's like, so they're just detrained. They haven't trained in a while. So it's either that is the reason they can't hit depth, or they don't have the mobility. But basically, the way I see it is, we've limited time, we've roughly an hour. Stretching is just not exercise. It's not going to have as many benefits as getting under the bar or doing a different modification. So I'm kind of like, we just keep getting the reps in, and eventually your body will adapt and you will become stronger and be able to hit depth. That would be kind of my approach, just because there's so many other benefits to movement that you don't get with stretching. So I guess, like, what do you think of that? Like instead of, doing the stretching, you go and you get extra reps in of the squat.
Yeah, I mean, that would typically be my approach, because a lot of it could be some of the reasons why a novice won't hit depth can be related to just motor learning. So like the way that our body learns to move and help us to navigate like different activities. Like, so if you're not used to it, the muscles on both sides of your joint are going to be turning, quote unquote, turning on and off at different speeds. Just making sure that I speak to more like a lay person terminology, where, those muscles be contracting on both sides. Well, if you have, a pulley that's pulling on one end and also pulling on other, things don't really move that way. So that can make it challenging to hit a certain position or depth of a movement or whatever. And then once you learn how to do that, you don't, it's like watching on those documentaries when like a baby deer tries to walk at first. It's like, we're all like that when we start something new that we haven't done before.
Yeah. We just kind of haven't had the time to sort of like master the task or learn the skill. Yeah. So even, for example, like I've been training for like 10 years or so, and I used to think like, oh, you have a bad squat. I used to describe my squat as like a folding chair motion. Like my back would just fold over. And now I'm like, I don't have a bad squat at all. It's just that I'm not trained or fit enough to hit an upright squat. And if I just keep at it, I will. I'll just progressively, I'll progressively overload my body. I'll progressively get stronger. My technique will improve also as I get stronger. There's nothing, I'm not broken, dysfunctional. I don't have imbalances. I'm actually just physically sort of like unfit or weak. That's like my thinking on it. So from that, how often do you think a client is actually like dysfunctional or has an imbalance or like is kind of incapable of doing a movement versus, just not having the fitness for it?
Yeah. I mean, more often than not, it's probably related to them just not yet having the capacity for something or not been exposed to something. Because even like clinically, when I'm working with patients in the office, like there's not a lot of times where I'm like, well, that person just cannot do that movement unless they have like, for an example, like turning your head or neck or twisting in a certain way. If you've had back fused, well, then there's a good reason for that, like why you can't move in certain directions. Or it's been a while, but I haven't worked with many people who had amputations. That might be something why, like when they do something, it looks different, or the way that their body is shaped even too. Like, and so you may do something, it may not look like how we think it should look, but if it fits, because there's lots of different ways that we're shaped and sized and things like that, it's going to look different.
Yeah. We're all individuals.
Yeah.
What are your thoughts around like some of the kind of diagrams going around online of like this person's femur inserts into their hip in this way, and that means they're not built to squat, or like, those kind of like points that are made? Do you think some people are just not built to squat and they should avoid it, or like is everyone capable of it? They just need to figure out their individual movement pattern?
Yeah, I think that's like more the case. Like it just doesn't make sense like why we would never be able to do something. Like it's just going to maybe look different for you, or you may have an experience that then allows like for a different movement to be just more beneficial for you, I guess, or like you may feel more comfortable doing it. You may like it more. And so like you can get away with that. Like there's no reason why everybody has to barbell squat or deadlift. Like you can do other things. It's just the way that my approach is, like I just look at what maybe gives us for the space or the equipment or whatever, maybe the most benefit for the time that we're spending on it.
Yeah. So you kind of make it work based on the resources you have available to you. So
yeah,
how often is it the case that like someone avoids like barbell training? So I say barbell training because you can tell me what you think of this as well, is because I would say barbell training is what everybody should aim for if they can, because it's the most effective way to do resistance training. So that's one point. But how often do you think it is that people just don't allow themselves to do barbell training because they tell themselves they can't? And they might actually be capable of it, but they just say, oh, I hurt my back deadlifting or squatting or bench pressing, or they have a limiting belief.
I think so. If it's a limiting belief, I think that's pretty common, like in general, because it's already such a niche of like people that are probably active already. Like if you consider that maybe 5% of people in industrialized countries are actually like sufficiently active to maintain and see like continual health benefits, then you got to think out of that percentage, like what amount of those people actually like enjoy barbell training and do it because they like it, rather than like they do it because it's going to help them achieve another end goal, like to play a sport or something like that.
Yeah. So there's so few people that actually do it that there's a huge resistance to it. What do you think in the clients you've seen? What do you think are the reasons that people stick with barbell training long term?
Yes, I mean, I think it's typically because they enjoy it, or like bodybuilders I see like where they maybe find it beneficial or they like to do it in some way, or like it's part of their off-season training or something like that. Or in bodybuilders, it's interesting because in powerlifting, like where I'm more gravitated towards, it's such a mainstay, and like because I have a home gym, it's just the versatility is just insane because I have very minimal equipment, but I can do just about anything that I need to. There's like a bodybuilder goes into a gym, like I have friends that are professional bodybuilders and they don't squat or deadlift. They definitely use a lot more machines and things like that. So it's like, just depends on that, or maybe the time of year you're in, or, what your goals are at the time. So some people, and people may look at that as like a recovery thing too, is where like if you're playing a different sport, it may be easier because of constraints of machines, where you're only doing like specific movement patterns, or you don't have to like learn the movement as much. It's maybe more helpful for your recovery in a way.
Yeah, like there's the machines, there's the barbells, there's all different ways to work out. So I feel like there's something for everyone if they just give it a chance. So you're speaking a little bit about clients you work with. So what is your specialty, and like what type of clients do you kind of specialize in working with?
Yeah. So in like normally for me, it's anybody that has like lower back, neck pain, upper back pain, just anywhere along the spine, and then headaches. I mean, that's primarily what I would see, but I'm well versed enough to treat just about anything at a fairly high level. Like people who have issues with their shoulder or their knee or their hip, just, you see enough people, but like, that's my main thing, is like anybody who has like back or spine related issues.
And for lower back pain specifically, I feel like it occurs much more frequently. Is that the case with injuries? And if so, why is it the lower back that is more commonly injured?
It's an enamor. Like we don't understand scientifically why that's the case quite yet, other than that there's multiple factors that go into contributing to lower back pain. Like a lot of things like, genetics, environmental factors, even like your socioeconomic status, maybe where you live, the type of work you do, maybe your fitness level, and just a regular exposure to things that we would assume to be risk factors for developing it. But it's fairly common across like just humans in general that 80 to 90% of people eventually at some point in their life have some back pain for at least like a day or two.
Wow. So it's really like 80 to 90% of adults are going to have lower back pain at some point.
Yeah, it's even higher than we used to think in adolescence too, but it's like, just because it hurts doesn't mean that's necessarily like disabling and like preventing people from doing things. So there's a difference between like the amount of people that might have some pain once in a while versus like the people that are like disabled.
Got it. Yeah. So the severity is different. And then can you differentiate between pain and then injury?
Yeah, that's an interesting one because of how like complicated pain is. Like there is a distinction, because like really pain is supposed to be more of like it's like a command. So it's meant to tell you like, hey, this is potentially threatening or could harm you, don't do that. So if it wasn't for pain, we probably would have more injuries than we do, right? Because it's meant to be there before you actually hurt yourself. Like otherwise it would be a bad alarm. Like you don't want your smoke detector going off like after your house burned down.
Absolutely. Yeah. It would just be totally ineffective. And something else that I've heard about pain is that, and maybe this is just applies to low back pain specifically, but most pain is non-specific, and then most pain goes away of its own, doing. So like, what are your thoughts around like, is most pain like non-specific, or does it typically target a certain area and then does it just resolve itself over time?
Yeah. So I want to touch on one thing before about like the pain injury. And we say that too, is like pain and injury is different, because also we tend to see is that there can be people that it's like 25% of people in industrialized nations, because I'm just saying this is where we get the data from, have pain longer than it took for like an injury to heal. So they have something, maybe they did injure themselves, it's healed, and now they still have. And then typically when we talk about like non-specific pain, because this goes for like the shoulder, someone's shoulder, their lower back, their neck, their knee. More and more we're finding that these symptoms, we call them non-specific in like as a research term to say that, because like I wouldn't tell somebody that in person just because it tends to be not very empathetic. But the terminology is meant to say like, well, we cannot reliably like say this is the specific source of the symptoms, or this is like, it's this muscle or it's this specific structure, because we know like, because of how complicated pain is and how the sensors kind of work in different areas, that it's too vague and unreliable to do a bunch of tests or even scans and be able to tell you like, yep, that's the exact reason why you hurt, other than if somebody has like cancer or fracture or some other like infection or something like that.
Yeah, so most of the time it's better off not to kind of like look into it or read into it too much. Is that kind of what you're getting at?
Yeah, because the thing is like you could hyper focus on stuff and you're like kind of getting lost in the weeds rather than focusing on the bigger picture. So like you could be like, oh, I really need to figure out exactly what's wrong with it, but that you may not need that to feel better and get better. Because for most of the non-specific pains that we are labeled in research, most stuff shows that if you exercise, you'll get better. Given time, it's going to get better. And there's a lot of different reasons why that can be the case.
Yeah, it's really layered, multifactorial. There's a lot going on. So just for example, if you were to finish this podcast, touch wood now, right? But you were to get up and you were to feel like lower back pain or knee pain or shoulder pain, what would be like some kind of questions you'd ask yourself or thoughts you would have so that like you could best manage?
Yeah. So this actually happened to me recently. Like I have chronic like back pain, I would say. And I had this earlier this year, I had some knee issues, and like my wife was saying to me, because I was like kind of hobbling just to get up and down the stairs. She's like, should you go see somebody? I'm like, who am I going to go see? What are they going to tell me that I don't know? But I would typically think of like, okay, how much am I sleeping? Like even,
do you know what's funny? Can you think of a client saying that to somebody else as well?
Yeah.
Could you think of a client like literally saying that?
Not very often.
So if a client, is injured, I feel like that would be a typical layperson response. What are they going to tell me? I don't already like, kind of.
That could be. But like I was thinking like with my knee, like I'm like, so like if I get an MRI on my knee, the chances are it shows that I have a meniscus tear is really high, even if I didn't have knee pain or something like that. But like, yeah, there's a lot of men in particular that would do that. Like, what are they going to tell me? My back hurts. I
already have the pain. What more is there to know?
Yeah. And that's a good mentality even to have. Like there's I forget the statistic, but there is a huge percentage of people say that never get to physical therapy, for example, that have some of these issues and they continue to live their life. They never experience, like they may have some degree of suffering, but not enough to where they're like, I need to assume this role of like being a patient or saying like, I am sick, if that makes sense.
Absolutely. Yeah. I think I heard something, I'm not sure, was it your own post or someone else's, but it was like farmers who have a very laborious job have like pretty severe injuries and they just keep on working, no problem, like just, with the pain or with the injury. So yeah, like just kind of getting back to like, how would you manage pain? Mm-hmm. So if somebody like a farmer can work like 6 days a week, every week of the year, for example, with pain, hypothetically, and some people might get a little tweak and they just stop exercising for a month. Like what's a useful approach or questions to ask yourself?
Yeah. So, I mean, I think to myself, like when I do that, like what's my sleep been like lately? How stressful has like life been? And that doesn't have to be even negative stress. It could be positive stress. Like if you're just doing a lot of different projects, you have a lot of things going on, like family wise, like whatever, like, so you're just thinking about how much resources are your body using at that time. If I sleep or eaten enough or like drank enough, am I hydrated enough? Like things like that, like very simple things. And then, I would explore movement a little bit and be like, okay, what can I do and still do that? Like when my knee was hurting, I still squat like almost the same weights. I just changed the things a little bit. Like I just squat to my bench instead of like to full depth, and then just kept doing that stuff. Like, so even though I could barely go up and down the stairs, I was like, well, it doesn't prevent me from like doing everything else that I want to do. So I'm just going to keep doing things.
Yeah. So you modify your approach. That's a really creative way to do it as well, because you don't get that full bend at the knee with the bench. So,
and the thing is that like, I would say even like an average physical therapist, like at least this is just my experience, like me thinking about not like people that I interact with online, but like people that I work with or have worked with, I would say like on average, they and even like average health professionals don't know to the degree about pain that I have like looked more into. Like I've read several textbooks and I continue to read like new research. So it's like just my understanding of pain. I'm like, well, it's like a physicist, like they just know how things in the world work. So they go, well, I'm not going to worry about that because I know X, Y, and Z. Like they have just this understanding of what it is in the process. So it causes you not to freak out. Like if I was a mechanic and something on my car broke, probably not going to be as big a deal as if it was like for someone like me who knows very little about how the car works.
Yeah, very good example. So then for people listening, or even just myself who's as skilled as yourself, what are some ways that we could manage pain more effectively? Like, I'll just give an example myself. So, I said I have the run coming up on Saturday. I was meant to go for a 2-mile fast run before this. And I just said, feeling a bit of like muscle soreness, calves are a bit tight and stuff. I don't need to do this run. And I have a workout coming up later on anyway. So I kind of just said I'd push it back to later in the week, and maybe I won't do it because, I'm trying to kind of deload almost this week. So it's kind of like, how do you know when to like keep moving, or like, what are just kind of useful questions for us to ask with less experience compared to yourself?
Yeah, it's usually like I would do this with people that don't have necessarily like maybe like, I don't know, I guess how to explain this. Some people get really like they need like a number to go off of like for pain. And then I have some people that are like, well, they can just like I had one girl I worked with, she's a teenager, she played I think it was soccer, and like I would ask her, well, when does it get severe enough that like feel like you can't do certain activities? And she would tell me like an 11 out of 10 pain. So I was like, okay, our cutoff is like a 10 or an 8 out of 10. So that way it would allow her to still like engage with activities and do stuff, but like within what she considered to be a tolerable range of pain. So like if you feel like something's tolerable, like keep doing it and stay active, and then kind of monitor what you feel like afterwards, like does it subside again within 10, 15 minutes back to like wherever you were before? Like that's just a general good rule of thumb, just to be like, allow yourself to experience and move and still do stuff and reinforce to your body like there is safety in movement rather than like avoiding things. Because that's part of like how we develop chronic pain is like fear of movement. And it may not even be like a conscious fear that we have, but like by having certain behaviors reinforced to your body, like it's not safe to potentially do this activity. So engaging with stuff again and just realizing like, oh, my opportunities to move and do things are actually much wider than I think they are right now, goes a long way in you feeling better, like quicker.
Get back to normal daily functioning then. Yeah. So that, or you can maybe the exact statistics, but I feel like the activity levels, or I should even, the activity levels are very low. I think it's only like 25% of adults meet the recommended, the World Health Organization's recommended.
Yeah. And that's being fairly generous because it's based on, those are based on surveys.
People over-report, yeah. So, okay, let's just say it's 20% of what be generous. Yeah. So 20% of adults do enough exercise. Would you say that the majority of people don't have enough experience with exercise to know when to push themselves and when to pull back or when to modify it?
I think so. Or they don't just maybe even feel confident enough. You know what I mean? Like, they just don't have as much understanding as like I would, and be like, oh, that'd be simple. Like I would just do this instead. Whereas I'm like used to that being like, oh yeah, if my knee hurts and I can't squat all the way to depth, like I'm just not going to go that far down. Instead of just avoiding it completely, I'll just change something a little bit, or use less weight. And I see this with patients too. Like I've had some where they're like, oh, I'm only going to lift light weights and like higher reps because I think heavier weight's going to hurt me again. Versus like, I'm like, well, you could probably progress back into that and it would be fine if you wanted to. But if you want to keep doing that, that's fine, I guess.
Yeah, you could probably do a lot more than you think if you just modified your approach. Yeah. So, you ever come across people who like don't enjoy exercise? Because we're kind of promoting exercise here indirectly, and we're just talking about it because we, exercise regularly. But it's like, do you come across people who just don't enjoy exercise? And like, what would you say to those people? If you had a client, for example, come in and they're like, I have chronic pain, and they're like, not going to move and I don't enjoy it.
Yeah. So then with those people, I almost make it less about like structured exercise, because like it's all dependent on like, I guess like where's the limiting factor, right? So like for me, the limiting factor for doing like yard work might be my like cardiovascular endurance versus
like a true powerlifter.
Yeah. Versus like my strength. Like, I can move furniture and like do all that kind of stuff and whatever, no problem. It's like if I have to do something for like a really long period and like the whole day, like that might be more limiting for me. So then with the person who doesn't like that stuff, then I go, okay, well, what stuff is it that like you want to get back to? Like, do they like to cook? Do they like to maybe clean or do crafts or whatever? And then make that like a part of their therapy. So instead of doing like, oh, you got to do these like specific exercises, well, let's, what are you doing around your house already? And let's portion that out into, sometimes paced and graded activity.
Yeah, because would you agree with this, that it's like, whether you want to or not, you're going to have to do some sort of exercise in your daily living anyway?
Yeah. And it's just, how do we make that to where now it's like beneficial and like giving them some kind of organization to the chaos that we live in so that they can kind of understand and modify and be more independent eventually of me into making some of those changes.
Yeah, like not everyone needs to run like 10K or lift, like 300 pounds or whatever, but do need to have some base level of ability, like the kitchen work you're talking about or yard work or something. So
yeah,
that's where
I saw a woman recently. She slipped on ice is what she told me. She slipped on ice and broke her ankle, like one of the bones in her ankle. And then I remember she initially didn't come for anything because it should have been straightforward, like in a cast, like it healed. Then she wouldn't have needed PT. She could have just gone back to her normal activities, but it wasn't healing correctly, even though they tried other stuff. So they did an internal fixation surgery with her. And she was very distraught the first day I saw her because this woman's life is a lot based on, especially in the city. Like I live in more of the country, just outside of the city. People there in particular, like I'm just not used to this because I grew up in rural. It's like if I can't walk there a lot of times or take the bus to get there, then it's like I'm not going to go and do that stuff. So for her, like it was very valuable to just be able to like get up, go walk to visit her friends or go to the store or whatever. I mean, most of what I gave her was just like paced and graded walking and like, hey, do this. And she got a lot better. And I think it was Thursday or Friday of last week, is when her last visit was.
Nice. So it's that graded exposure to exercise after an injury is how you return.
Yeah. And that's the thing with even like, I've had people come in and they're like, yeah, I have the hardest time like doing laundry. I go, okay, well, like how long does it take you to do your laundry? Like, are you doing it? And sometimes we've just had them like space that out. So instead of doing like all their laundry during, one day of the week, like do some loads through the whole week, and you're having to do that activity. And then eventually they're like, oh, well, now instead of doing like half a load, I do a full load. And now I do, can do 2 loads a day or whatever. And then now they're just doing all their laundry at once.
They went from doing that on the one day to doing it on multiple days or vice versa.
Yeah. So instead of doing maybe like you have to do like 3 or 4 loads a day, and that's a lot for them to pick it up, carry it down their stairs, go to the washing machine. Then I'd have them do, okay, well, like take half a load down and do that like multiple days per week. And then eventually like, just throw an extra towel in or, an extra shirt or 2 or something like that. And then eventually they're like, oh, I'm doing all my laundry all at once.
I might have to steal that one because you're telling me that going down with the full load in one go, we have stairs as well. Yeah, it's a lot. It's actually like doing a workout, but just with kind of touching on like spreading out the total work you do, doing it over like a week, especially with chores. Mm-hmm. I feel like that's a way to like adapt to like an active lifestyle by doing more activity on a regular basis. Mm-hmm. So do you have any kind of like quick and easy tips for people to like incorporate exercise into their daily life or just in their weekly life to have a more active lifestyle?
Yeah, I mean, some of it can be like for just a person maybe doesn't exercise. It can be as little as like park my car further away from like the store. You purposely, instead of taking an elevator, you take stairs. Other things, I heard Greg Nuckols talk about this too. And this is something that's actually been like researched. They've looked at this in like office workers where they have them do like exercise snacks. So it's like getting up and walking around or like, walking on the stairs for a few minutes, like 5 minutes, I think is all they needed. And they saw like a significant benefit. But it's like you can go from, a lot of people go from college and then you see they go to like an office job or now working at home. And then you like completely like stop moving as much. Like I remember in college, like I wish I had a Fitbit or something back then, because I bet I probably walked like as much or more than I do per day now. Because I didn't really use my car. I just walked everywhere on campus. Whereas like having them do stuff like that. So like, you know what, I'm going to get up and like walk around for a couple of minutes. Cause like, that's another thing too, is like, it's still a thing. Like people still smoke and like those smokers get like 15-minute breaks, I think every once in a while. So it's like, technically you could just get up, walk around, be like, oh yeah, I'm going to use whatever excuse. Like if you have to use like a smaller water bottle, I'm going to get water, or if you drink a lot of water, then you have to go to the bathroom more. Like things like that. Yeah,
absolutely. Just I feel like it's engineering exercise back into your daily life, because like with technology, it's been strategically like engineered out. We save time, but we lose our health, I feel like.
Yeah. And I've thought about that too. Even like I like my wife and I both will watch like historical shows together. And I'm like thinking, if I wanted butter, like, my grandparents were born in like the late 1800s. So much different time than now. And like, it was like, if they wanted butter, they actually had to like churn it to get butter. Like I can just go on my phone and like go on an app and go like, oh, I want this at the store, and somebody will bring it to my house.
Yeah, we have to do so little work when we compare it with generations past. I feel like that gives us more time to exercise in a way, though. I used to cycle around the city for transport, and I use an electric scooter now. And I'm like, I'm losing out on the exercise. There's like obviously huge exercise benefit to cycling, but I like to think of it as now I can actually choose how I exercise as opposed to having to exercise for transport. So do you think people have enough time to exercise?
I think you can. It just depends on what your priorities are, right? Like, and some people might not be in a life situation where it seems as feasible or approachable to make it part of their regular daily life.
Yeah, when you see someone like like a single mother with like two or three kids, or just like someone who like has their own business, and they're just anyone who's got very limited time. How do you help those people who are particularly challenged with time to increase their activity?
Yeah,
if they're not exercising enough,
that may be like either like having them like restructure, like schedule it in or something like that, or like for like somebody who has kids, it's like that sometimes is easier because you can be like, well, what are things that your kids like to do? Like, can you play with your kids? And you could be active in those ways. Or maybe their kids like some kind of activity, and now they're doing that more with them to get them a little bit more active too. Or if it's like, I just don't have the time. It may be like, okay, well, where in your day could you like feasibly get like 5 minutes? So then they can have a short, because short doesn't mean bad. Like you can get high intensity work for several minutes, and that sometimes has the health benefits we're looking for.
Absolutely, we can keep it like short and sweet, and just be really effective with how we exercise. Yeah, if we have limited time. So just going to some of your posts on social media, they're like very interesting and informative, and I recommend anyone to check out Jacob's content. What's your Instagram handle again?
Strength in evidence _physio.
Yeah, the operative word being evidence. There is so much science in your posts. It's like very, very impressive. But one of your posts is if it hurts, just don't do that. I feel like that's a lot of people's kind of like common approach to different like movements. So for example, the most common one is probably deadlift. They hurt themselves and it's like, it hurts, my lower back hurts, so I'm not going to deadlift. And basically the questions that I had from that were, you talked about blaming, stigmatization, and frustration as it relates to pain. So can you just talk a little bit about those terms, that idea?
Yeah. So the idea with that is like, somebody might get hurt while doing something, and you can get like multiple types of like stigmatization. So it's either like people blame you for being injured, or like be like, well, why were you doing that? Or like, I've even seen that where like you go into like, I don't know, like an emergency room or your doctor's office, and they're like, they just don't understand like why you would be like, if you're a power lifter, like deadlifting the amount of weights that we would lift. And they're like, I just don't understand like why we would enjoy doing that. And be like, well, why do you enjoy doing whatever it is you like to do? So there's that. And then like, just by like telling somebody like, if it hurt, don't do that, it's just not helpful. Like there's no actionable solution to that. And it's like, well, do they want to be able to do that again? Like, and sometimes like that's a way to increase their fear associated with something. So like I've gotten more into like recently these theories that relate to like chronic pain and like development of pain, where it discusses like fear versus safety related movement. And there is a decent theory out there that like they discuss, your body is weighing all this information that's coming in constantly, right? And you aren't aware of it all the time. Like that's why we only use a fragment of our brain to like consciously interact with the world, because like we use 10% of it like actively, like I am aware of what's happening, versus like the other 90% is doing all this stuff, like that physics stuff we don't have to think about. It's understanding like what I'm seeing, like it's connecting all these different parts. It's organizing things in my body. Just so much is going on. And it's filtering this information. So based on that stuff, it goes, well, is this safe for you? Is this potentially threatening? So I'm going to make, oh, well, I think it's could be harmful. So you should have pain with this. But if we consistently tell people like, you shouldn't do that if it hurts, then you continue to reinforce this pattern then with that, whatever that information is that comes in with that movement. And there's their own conscious bias or association with an activity where now they're going to say, well, I'm not going to do that because this health professional said that was bad. I shouldn't do that. I need to move this very particular way. And by doing that, we're reducing the opportunities then you have to engage and interact with different things, which then creates this ongoing cycle now. Cause like if every time something hurts, we just tell somebody not to do it, well, eventually they're not going to be able to do anything. And you paint yourself as a practitioner into a corner where your options of like things you can have that person do are very limited now. By limiting ourselves, that's the thing about humans is like, we need that, it's like kids. You don't just put a kid in a box and just go, okay, you're going to grow up.
Absolutely not. No. The first example that come to mind with if it hurts, just don't do that. It's like, dating, for example, it's like, oh, it's too painful to date. And then like, could you imagine like someone just saying, oh yeah, just don't get into a relationship at all, or getting out of bed in the morning. It's like, you're like to your doctor, yeah, it just kind of, it's tough getting out of bed in the morning. The doctor's like, yeah, just don't do it. Don't get out of bed. And it's like, no, that's not how you grow and develop as a person.
Yeah, exactly. And that creates issues where now we're getting in the way of those things where things get better on their own. Typically, like we're creating a barrier to it getting better on its own.
Yeah, absolutely. I feel like there's kind of a point that we're not talking about it in that like benefit of exercise, like, and just movement and like almost like more exercise is better.
Yeah.
Would you agree with that?
I mean, typically like the way you think about it is right. There's multiple things. Like, so people talk about as I get older, they feel like they get injured more. A lot of that's because you just have more exposure and opportunities to have gotten injured. So you're like, well, I just remember more like these times versus like when you're a kid and you just do something and not think of it or not remember it. And so that also can help people develop like the different contexts or like frames of references of like resiliency, where you could potentially think at more like, well, when have I done something that would be fairly challenging or difficult? Like, how often do I physically challenge myself? Like, if I'm deadlifting, say like today I'm supposed to work up to 515. Like, if I do that, like, why would lifting a 20-pound box, like, why would I think that that's hard if I can physically do the other? You know what I mean? Like, so your body has another context to be like, oh, well, like we've done this thing that's way more challenging than this. This should not be threatening at all. Like even at a subconscious level.
Yeah. The challenge makes us better. And so I want to talk about the Kevin Bath debate. Also the language you use. So you said you're supposed to work up to 5:15. So does that mean that you're unsure if you can do it, or that you're going to see how you feel and you'll go by how you feel?
Yeah, I'll see how I feel, like, because it depends on my recovery on a day. Like I might not be able to actually get to it. That's the target, is to do that for 3 sets of at least 2, and then an AMRAP at that actually the last set, a third set.
So it's that you're talking about auto-regulating your training. Is that right?
Yeah. Yep.
Matching the stimulus to your ability on the day. That's the Kevin Bass debate. For anyone who doesn't know, Kevin Bass says the general population should avoid heavy squats and heavy deadlifts because they're not worth the risk to reward. The risk of injury is not worth the benefit. So what are your thoughts on his position on that for the general population?
Yeah, I've mentioned this like before, like where, weightlifting, it's like, if you want to do it, do it. Like the potential risks are not actually very high. And I think in general, like, should be encouraging people to do more of that, like, since people already have a bias away from that. And I've mentioned this is like recreational running has a significantly higher injury rate, but like how many people are telling people not to run or like ride their bike or things like that? Like you don't see that happening. So it's like, why are we picking these specific things? And there's also probably greater drawbacks to not performing like heavier resisted exercise just in general on like your bone density. It has a lot of benefits for your blood pressure, cartilage health, and like just the general resiliency and robustness of somebody's body. Like you don't need to do them. Yeah. But should you do them? Probably. And there's a lot of things that are not very safe that we do on a regular basis. Like we drive cars. One of the things we've been talking about recently to kind of point out how ridiculous explicit is like a couple of the guys have been getting into like the research on injuries during like sexual intercourse.
Oh, I saw that post. That's actually hilarious. Yeah.
Yes. So it's like there are a significant number of injuries, but if you just went around and told everybody, well, you have to be celibate for the rest of your life because of the risks of reward ratio.
Yeah. And I actually, now that you mentioned that, like people slipping in like the shower, for example, just like injuries in the shower, or is it like there's so many benign things like that people get injured in just in their daily life, and it's like, and they're not even trying to like get a particular benefit. And it's like, at least if you got injured trying to weightlift, you'd be like trying to get like stronger. It'd be for a reason.
Yeah. And it's interesting because I like I was saying, like history. And so this YouTuber I follow, and I'm gonna hate myself for, I don't remember his name. It's Max something, but his channel is called like Tasting History. And so he goes over like, he's like, this is a recipe from this time period, and then like goes over the recipe, and then in the middle while it's cooking, he like gives you the history behind it. And then like, so he did like ribs, and he's like, oh, I'm gonna do like, where did table manners come from? And he was saying like the number of people that used to die from like choking while eating before the Heimlich maneuver came is like a reason why one of the things that are like table manners came up, because it was a way to get people to not eat in a way that would potentially increase their risk of choking. Wow. Because it was such a huge like problem that like lots of people would be like partying or doing stuff, and then they'd like choke on something and die, and there was no way for them to like, well, somebody was like, oh, we can just, you know, if we press real hard here, it'll make them spit out that food.
Yeah, over time we just learn more effective ways to act. That kind of reminds me of the point of like the source of information you get from. So it's like you get credible source of information, then you have like reliable approaches on how to, like, you know, we're talking about exercise, so how to exercise more effectively. Yeah. Whereas there's a lot of misinformation out there, so you just have to be careful of the sources of information.
Yeah, and generally, like, I am of the approach, like, yeah, like when people talk about like technique or different things like that, I'm like, well, you know, if somebody's gonna play basketball, like, yeah, you want it to look like it's basketball, but there's lots of different ways you can approach like playing and like styles of play and positions, and you know, there's all these other things. It's like, well, here's some basketball. You just have to know what a basketball is and like, in the general rules.
Absolutely, yeah. It's like once you get past a certain level, you can get creative with like fundamentals, and you can like turn it into your own kind of thing of like, you know, for example, Steph Curry like shooting from so far out, whereas typically people just do like dunks and layups and stuff or whatever.
Yeah, exactly.
So just another interesting post you had is exercise is thought to impact fear avoidance behavior. So this is kind of getting into like the psychology of exercise. So could you just define like what are fear avoidance behaviors, and then just could you define like pain education and just, you know, the whole idea and message behind that post?
Yeah. So I don't remember which one that might have been specifically. The general idea is like fear avoidance behaviors would be like, you know, I'm not going to do this, or I refuse to do that, or anticipating that like something could be harmful for you to do it. Like, you know, like I'm not going to bend down and pick up something or tie my shoes because that hurts my back. And then becoming fearful of doing that. Like, I don't want to do that because it hurts. Or some people might have been told like it has a specific effect on like the disc in their back or something like that. So typically what we see is that with pain education, so pain education would be like the education on like, it's a way of explaining how pain works, just like you would explain to somebody like the anatomy of something, or like, you know, this is the color blue, like that's what it is. And how our body goes about this process of, you know, you having pain. Because there is still even misinterpretations at the highest level of science, where I've seen papers recently that have said like pain, like they say, oh, well, like say I stretch my finger back, it would say like when I stretch my finger back far enough where it hurts, my body's sending pain signals to my brain. But like, that's not how it works. It's a contextual thing. Like, it needs a context. It needs some other inputs. It's a decision by your body to say, hey, I need to do this to protect you for some reason. And so with the education, and the thing is, the education has to be coupled with movement, because it was, when this first came around, as being like a movement of like educating people on pain, like the pendulum swung very far, where I think a lot of people were like just like kind of lecturing people about what pain was, and like saying like, you know, this and this, and like sitting them down, having session long conversations about it and things like that, which I'll do, but I don't lecture them. It's more of like a conversation. Like, they have questions, so I'm answering their questions. But if you're going to take that approach, it has to be very active. Like, you know, it'd be like me trying to take, like, I use this quote, and I always forget who first said it. But it'd be like me trying to take down a brick wall by throwing some like cooked spaghetti at it. Like, it's not really going to do a whole lot. So unless you pair it with activity, you know, you can tell somebody something, but it's like good storytelling. It's like, you see this like right now, like with Rings of Power and the new Lord of the Rings or Game of Thrones show, like there's a lot of in good storytelling showing you things, but not always telling things. So you're like, you can do this, or this is what's going on. And so then you get people to be like, get that like light bulb, like, oh, now I get it. Because if you just tell them, like, that's where you get into, this is a nerd in me, where you see like the prequel Star Wars movies, like did a lot of, they tell you and give you exposition versus just showing you stuff and then you figuring it out and you go, oh, okay, that makes more sense now.
Yeah, absolutely. So yeah, narrative is so powerful. That's really an interesting way to coach people. And just in terms of like fear avoidance behaviors, like what are the limitations with that with exercise? So like, could someone be like low on confidence, right? In January, let's just say they start the gym in January, and by like June, if they stuck with exercise for 6 months, like, have like less fear in their overall life, like in and out of the gym, like be more like open to experience, and like maybe be like physically stronger, like physiologically, but also like psychologically stronger in terms of like how they interact with the world.
Yeah, because I think that's something, and that's something that I post a lot about, is like there's a general negativity about the ability of our bodies to adapt, which I think it's partially like hardwired into us for survival reasons. But there is something to that. Like you typically find that like the more you stick to it and the more you can see what you can do, then you do develop better self-confidence, self-efficacy. So feeling that you can do something or you're capable of it. And then you see people like, oh, actually, like that doesn't make sense why that might hurt me, or I would think I would get injured while doing that when I can do X, Y, or Z.
Yeah. They kind of reconfigure their outlook. So just going back to the point about Kevin Bass's like stance on lifting heavy, what should people aim for in terms of like the weight they lift to sort of like maximize the benefits and maybe minimize the side effects? Because like, as you kind of said already, like the weight you're lifting, or like that I might, we're not necessarily doing that for health benefits. It's almost just purely like intrinsic enjoyment or motivation that's keeping us going. So what are like some good strength goals to aim for to get the majority of the benefits?
Yeah. So like if you want specific goals, there's even like we were talking about barbell medicine off air, but I remember listening to one of their research roundups. I think it might've been early last year or early this year, where for like, there seems to be like some strength benefits or like goals that seem to correlate well with like increase in health markers. One of those is like you can leg press, it's like 1.9 times your body weight, and the ability to bench press 1.1 times your body weight seems to relate well to long-term like health benefits. And just in general, like even for a man, being able to have a grip strength of like 60 pounds, or for a woman, at least 40 pounds, because below those are markers of like sarcopenia, so like muscle loss. Those are generally like good ones, or like CDC has like guidelines for like sit to stand out of a chair, like goals, like where you kind of like should be on average. Those are some of them. And then like in general, like if you're in the gym, I would explain like I use rating perceived exertion, like a 0 to 10. And I use this clinically. Typically, no matter what rep range I'm in, I'm trying to get somebody between like a 6 and an 8 out of 10 difficulty on whatever the exercise we're doing is. Because then I know it's like going to be challenging enough to stimulate them like continuously. Because then also the stronger you get, like the only way to increase then the RPE is to make the exercise more challenging in some way. So, okay, you're getting stronger. So instead of like, me rowing a 30-pound weight, feeling like it's an 8, well, now I'm rowing it and it feels like a 5 or something like that, right?
So yeah, kind of figuring out a baseline, like 60% or 80% of your ability, and then applying progressive overload to increase that over time so that you're still getting a challenge. Because you don't want to do like, 50 kilos or 50 pounds on the squat in week 1, and that's your 60%. And then in week 10, keep doing it. And you're like, this is actually 40% now. So it's like, you need to adapt the load you're using to get more of a benefit.
Yeah. And I think the only like non-smart ways to lift would be like, it's tough because there's so many different ways that you can achieve the goals, and like you still don't see like high injury rates. The exposure to absolute loads, unless where they use like, I've discussed with people who talk about like envelope of function. So it's either it's having to be a significant amount more of a load than I've ever done before, or just like a ridiculous number of repetitions of something that's really easy. So it would have to be something completely outside of your norm, potentially to cause or be like Yep, that's definitely what injured me. And I've seen the only times where I've thought about and then been like, yeah, that probably wasn't really smart for that person was so someone I know was like in a contest prep for bodybuilding. So they're already at a low body fat percentage with not a lot of food coming in. Like it's just not a good situation to be in, like where your body's going to be like, yeah, I'm really primed to be stronger than ever. And then they were doing like daily maxes on deadlift, I think it was. And then they end up hurting their back. I was like, well, that kind of makes sense.
Absolutely. Yeah. You're kind of training past your ability there and sort of just almost like ego lifting in a way, like as in it's a very rare situation where you need to actually test your max. And if anything, like, moderation, really, like a moderate approach, but still getting a challenge is going to be the best long term.
Yeah. It's just like with anything, right? Like if you're trying to cook popcorn, you may not put it in the microwave for 10 minutes.
Absolutely. Yeah. I'm thinking of a training question I have. Do you mind if I fire one at you just?
Yeah, go ahead.
Training. So I'm into the 6th week of my current training block, and I'm just tapering down my volume. So I'm just going to do one squat session this week because I have to run on Saturday. I'm going to do squats, and I've been doing like, not kind of like 70% loads. And in like 2 to 4 rep range is kind of what I've been working with. And I'm thinking of increasing the load by roughly 5 to 10% for today's session, right? And I'm going to do that for 4 sets and just go like 4 by 1, basically, right? So it's like it's pretty far away from my 1 rep max, but it's still, the intensity is pretty high. And it's purely just, this is like, I've kind of been working up to this. Also, the risk is not worth the reward, because if I get injured this week of all weeks, I can't run on Saturday. So I'm like, really, this motivates me. I'm looking forward to this, but also I'm very acutely aware that I do not need to do this. So what are your thoughts on my thinking there? Do you think I'm being unreasonable, or do you think it's...
No, I think that sounds like more of a moderate approach. Like a 5 to 10% jump isn't like a huge amount. And if you've been doing it for 4s and you're only going to do it for a single, and that sounds more reasonable. And that's almost like as a similar, like I might do that as a taper, like myself anyway. So it's like still stimulating to maintain strength or even potentially gain strength. Plus you're tapering into a competition of like running. So it might actually not feel as bad as because your absolute volume accumulation might not be as much.
Yeah, that's literally what I'm doing. I'm tapering the volume down, and I'm just trying to maintain strength, really, because
you're more focused on your running. Yeah,
that's my number one goal. Yeah. So I'm trying to concurrently train and not burn the candle at both ends, but still have a little bit of strength for the squatting.
Yeah, that's actually not a bad approach to be taking, where you're just doing like, if you're thinking about gaining strength, like you're being more specific and with not as much volume. And if anything, like that's the thing too, is like with weightlifting, it takes much less to maintain it than it would for like aerobic fitness. If aerobic fitness, like you don't run for 2 weeks and then you try and go run, like you're going to be fairly gassed. But like with weightlifting, you can not like lift for 2 weeks and go in and they still almost do like the same amount of weight.
Yeah, it doesn't, the detraining effect isn't as strong. Yeah, right. Yeah. And that short approach to training of like 6-week blocks, it was like another guest I had, like, so Dr. Pack is what he goes by because his name is Greek and it's particularly long, but yeah, the shorter blocks are what I'm using. So I guess it's not a wild approach at all.
Yeah.
So then just the final question I have is one of your posts is kind of funny. It's so I'm active at work and that counts as exercise. And then your post was, well, yes, but actually no. So the physical activity paradox and how your activity at work might not count towards physical exercise. Can you talk a little bit about that? Because I would have been of the opinion that like all movement can be exercise.
Yeah. So because this was interesting. When I first was like looking at this research, because it was unique to me, and that's why I wanted to do the post so I could learn about it too. What I was finding when I got into it was that it finds that like 50% of people that have physical jobs work outside, so they're in environments that are not well regulated. They don't have the ability to take breaks when they want to. They don't have the ability to like maybe hydrate frequently. And what they found in the studies that they have been looking at this is that because of that and the uncontrollability of environment and stressors and stuff like that, for some reason, this creates like some sort of like chronic like inflammation and it's kind of like that burning the candle at both ends aspect, because it's like they may work long hours doing very physically demanding things without ability to take breaks like we would with regimented exercise. Then seems to increase their baseline levels of inflammation and increases their blood pressure, which then, because they're doing this on multiple days in a row, it doesn't allow that to then come back down, which would normally be your recovery, right? So those things happen while we exercise, but then it comes back down, we recover, we go back to it, and then it, starts a process all over again. You're not getting the same aspects of recovery. So it's creating this chronic state of inflammation and increased blood pressure, which then over time leads to worse heart health and things like that.
That's interesting you say that, because it makes me think of, so during the pandemic, the gyms shut down. So then I had to, just quickly grab whatever work I could. So I was doing furniture moving. And it's funny, everybody who I talked to would be like, oh, you must have been so fit. You must have been moving all the time. I'm like, I was. That kind of chronic inflammation was very real. So you might work 3 to 6 days in a row and be working way too hard. In terms of physical exertion, there's no breaks, water. And it's really a tough physical job. And it's exercise, but it's not structured exercise. It's really random. So it's so easy to do too much. And you might actually do too much and have to go again in the next hour, the next day, and just, So your job does not count as exercise, even though it is movement.
It's interesting because we see this in some of the studies, they've accounted for the negative health habits that people in these groups or, socioeconomic status and stuff like that they might have. Because there's also a white collar paradox where they don't move enough anyways, and that's where we're seeing the issues of obesity. But then you see hunter-gatherer tribes, I forget the name of the main tribe that Herman Poncer studies them. He's the evolutionary anthropologist, and he talks about metabolism. They're constantly moving and stuff, but I wonder if it's because they have a goal, and they do have those times where they will rest, and it's this is part of their survival. If it has a different physiological effect for them too, than it does for when it's created because of this work that we don't necessarily want to be doing also.
Yeah, it's all about how you do it, really. Yeah. So if you can get rest when you need it, then you'll be able to recover and, come back again the next day and do whatever you need to do.
There's some of these things I'm just speculating on based on what I have read, but wouldn't say that I have the definitive answer.
Absolutely. We do need to have structure to our exercise programs. Otherwise, we run the risk of doing too much or not doing enough at all and missing the benefit. Yeah. Jacob, thanks very much for your time. This has been brilliant. Is there any final messages or points you want to go over, or anything you want to plug?
I'll plug my Instagram, so strengthenevidence_physio. And then obviously I'm in coaching now myself. So I'm taking on primarily more powerlifting based people. I also take general population or people that are if you're someone struggling with injury or something. I have all the links on my Instagram bio, but that's for ATP performance.